Is forward head posture affecting your respiration? It probably is. Watch this video to find out more.
Let's go.
Hi and welcome. I'm Coach Tonya with Criticalbench, and in this video today I'm going to be talking about forward head posture and how it's likely affecting your respiration. Now, a lot of us know about forward head posture or have at least heard of it. Maybe you've heard it referred to as text neck, but in any case it's not, above not looking aesthetically pleasing. It's actually not really good for you or very healthy for more than just spinal reasons. So I want to talk a little bit about that, but before I get into how it's directly affecting your respiratory system, I want you to check out that pinned comment below for the forward head posture fix. If you have forward head posture, if you have text neck, if you spend a lot of time on mobile devices or looking at your phone or sitting at a desk or even driving, you likely have some degree of forward head posture, and this program here below that you can check out in the pinned comment is absolutely, hands down, probably the best one that I know of that can help you start to correct that and alleviate a lot of symptoms associated with your forward head posture. So please check that out, read all about that product, and you can start doing something today to help yourself with that. Okay, so forward head posture. Now, as always, I've got my trusty notes because I just don't remember numbers and dates and data and things like that like I used to, or maybe I never did. Forward head posture, or sometimes you might just see it as FHP. At first glance, clearly it's not really aesthetically pleasing, and at first glance what you might notice when you look at somebody or maybe looking at your children is they seem slouched. So what you notice initially is like these slouching shoulders, which definitely is part of it. But beyond that, it's, basically your chin kind of juts out, like, lots and lots of time, hours actually now, like in today's day and age, looking at mobile, looking at our phones, like, okay, I've got a phone. Brought my phone here just to show you, like when you're sitting here and you're like doing all this stuff on your phone, and I'm as guilty as anybody because the work that I do, a lot of it is done online and digitally. So as long as I have this, I can work anywhere. So there's a really good chance that if I'm out and about or if I'm traveling, if I'm even out having coffee and I get an email that I need to address right away, I'm sitting here doing this. So over time, that tends to cause this chin sort of jutting out. That puts a lot of extra pressure on, it's called the atlas. It's the first vertebrae in your cervical vertebrae, in the neck here. So the top, just think of it as the top bone in your neck. It's putting a lot of pressure on that. You get this unnatural curvature of the neck, which causes all kinds of problems: headaches, tension, tight shoulders. But what I want to focus on is how this forward head posture is directly affecting and possibly compromising the functioning, the optimal functioning of your respiratory system. So when we look at forward head posture, going back, several, like 30, 40 years ago, it wasn't uncommon to see this sort of thing happening with elderly, okay? As we get older, bones tend to become, we tend to lose some bone density mass, and so that can contribute to this kyphosis, and maybe you've heard the term hunchback, things like that, and just, slouching and not having great posture anymore, it all contributed to that. But with the advancements in technology and things like iPhones and iPads and computers, and more people able to work remotely, work from home, spending a lot more time sitting at a desk, we're seeing this forward head posture in huge numbers in the younger population. And who do you know, even, I'm just trying to think age-wise, wow, because I have nieces and nephews that had iPads and phones at a young age, but who do you know that's like 9 years or older that doesn't have some form of a mobile device? Yeah, kind of hard to come up with that. So definitely with the way we operate these days and how we work and how we socialize and entertainment, we're certainly all across the age brackets. We're definitely spending much more time on mobile devices than 30, 40 years ago. Now, forward head posture is so common, and this is a big range, but everywhere I checked, it was pretty consistent within like 5%, but it's so common right now that it affects between 66 to 90% of the American population. So we're well over half the population that has some degree of forward head posture. And looking through different sites for like chiropractic, rehabilitative clinics, things like that, a lot of professionals are seeing people that have this, and they're getting patients or clients that are complaining of like sore neck, headaches, upper back tension, things like that, they're constantly coming in, whether it's massages or therapy, stretching exercises, mobility movements to help alleviate that. This is what professionals are seeing a lot of. And, we need to actually be more concerned with forward head posture outside of the fact that just it's poor posture and it doesn't look good, because the negative effects it can have on respiration have actually been studied rather intensely for quite a while now. And the findings tend to be very consistent. I looked up several different, over the last few weeks, looking up a wide range of studies, meta-analysis, spoke with a couple doctors, spoke with a couple chiropractors, other health professionals that are, specifically deal with posture and spinal alignment and things like that. And they were all pretty much in agreement that this posture does, over time, definitely compromise respiratory function and can get significantly worse if measures aren't taken to correct it or work on better posture, okay? So nobody has to give up their phone, nobody has to give up their job and working at the computer, but there's a lot of things that we can be doing daily on a regular basis to help correct this unnatural curve, alleviate a lot of that tension and stress we're putting on our neck, on that atlas, and opening up the chest to allow for the respiratory system to function at peak or optimal capacity. Now, one of the most recent studies I found that I really found very interesting and very valid, because it was actually a meta-analysis, so a combination of very different studies that were all looked at and compared. So this was done in 2018, and I want to read 2 sentences from the conclusion of that, because the whole study was really, I found it fascinating, but I'm a geek that way. But in the conclusion, what was stated was this, that the alteration of head and neck positions can have an immediate negative impact on respiratory function. Immediate is what really got me like, whoa. It goes on to say that clinicians should be prompted to assess respiratory function when assessing individuals with forward head posture. So what that says to me when I read that, my interpretation is that if somebody walks into an office with forward head posture, and like, my neck hurts, I get these headaches, I need some exercises, I already need medication, I need some help to correct this. Beyond providing the necessary help to correct the forward head posture, that person should be assessed as to the function or the optimal or lack thereof functioning of the respiratory system. And to me, that's a huge red flag, especially when we consider 66% to 90% of the American population have some degree of forward head posture, and we're seeing a greater percentage of that in younger people. Okay? Big red flags. Lots of red flags in those 2 sentences. All right? So if you have forward head posture, and I myself have it, but at my desk, I do little exercises regularly, little movements, and you can check out on our channel. We've got tons of videos to help with forward head posture, as well as that program in the pinned comment, which is hands down amazing. I do things at my desk. I do things daily because I always am sore and tight in my neck and my upper back. And what I have noticed is that after a few minutes of doing just a few simple exercises from that forward head posture program, I do find that I'm breathing deeper, because when you think about it, if you're sitting like this without even knowing it, or you might start out in the morning, great posture, and then slowly over the day you get tired, start to lean on the desk. Okay, maybe grab the phone a couple times, you're doing the phone, and you're looking at the computer, maybe you're checking another screen. You're constantly, this chin is stuck out, and that's really creating a lot of pressure and stress and tension here. It's going to get sore. It's just naturally going to get sore. And we start to overcompensate and compromise. So now our shoulders slouch. We're trying to be as comfortable as possible. But as we do this, see what's happening here? This is becoming constricted. Now think of how efficient, how optimal is breathing like this versus breathing like this. Huge difference. And it doesn't take a huge, big, intensive, complicated program or 1-hour workout to do this. This is just a few minutes sitting at your desk a day to remind yourself to get straight, push that chin in, do this a couple times, and take a few deep breaths. All right. Now, when your posture, poor posture in general, like does nothing to support optimal function of your respiratory system. So if you're having, or if you have forward head posture, it doesn't just affect you when you're sitting, it affects you when you're standing as well. So if you've got that forward head posture, again, depending what degree you have it, you know, how slanted is your neck? How slanted is it? Is it like this? Is it like this? You know, you're going to have some compromised function. You're not going to be taking those big, deep breaths that are really important for a lot of things. For instance, if you have poor posture and your respiration is compromised, you probably find that you tire much more quickly. Now, it's not the only reason why you're going to tire, but we're talking about forward head posture, because I know some of you are probably thinking, well, what about exercise? What about diet? Yes, check. Those all definitely have an impact, but talking about forward head posture. Poor posture, that forward head posture, and then overall poor posture is causing this constriction. You're not breathing deep, those nice, deep, relaxing breaths, probably a lot of shallow breathing, probably breathing maybe at a quicker rate, maybe for some of you. So you're going to tire more quickly. You're going to have lower energy. If you're not if your breathing isn't optimal, your brain's also not receiving, optimal amounts of oxygen, which is going to affect your cognition and your thinking and your problem solving and your reasoning and how you cope and deal with stress. Your workouts will suffer. If you have poor posture and you're not breathing, your respiratory system isn't operating the best it can be. When you go into the gym, that poor posture comes with you, that limited, restricted, shallow breathing comes with you. How much better are your workouts going to be if you're able to take nice big breaths because you're standing straight, you're standing tall, and you're doing things to correct that forward head posture? Also, your sleep is going to suffer because poor posture transfers to sleep. A lot of us think that, once you go to bed and you lay there and you relax, everything just kind of falls into place and it fixes itself overnight. Not really. Not really. A lot of us, our sleep posture isn't great as well. Some of us sleep with too many pillows, too flat a pillow, on a bad mattress, maybe no pillow at all. So again, that poor posture and that forward head posture that you are carrying with you throughout the day comes with you to bed at night. Your sleep is going to be, sleep's going to be affected. You're not going to have that nice, deep, easy breathing that you should. Now, when it's not addressed, when you don't address your forward head posture, it definitely can become increasingly worse. That slant can become exaggerated. It's going to directly affect that chest expansion and the ability of your respiratory muscles to work effectively. It's also going to cause possible weakening of your diaphragm. So your diaphragm is that muscle here that when you breathe, it's a muscle and it expands and contracts. So again, if we're kind of getting into the slouchy posture consistently without correcting it, that diaphragm isn't expanding and contracting in its full range, we'll call a range of motion, its full capacity. So it's going to become weak. Just like if you never exercise and never work your biceps, they're going to become pretty weak. They're not going to be strong and healthy. So when the diaphragm becomes weak, that also will affect things like your core stability, and that can lead to other musculoskeletal implications that are related to spinal instability, because all of this is connected, folks. It's all connected. But the good news is that you can do something about this. You don't have to have surgery. You don't have to be on a lot of pain medication. You don't have to do hour-long workouts to fix it. You can start doing little things every single day that take you just a couple minutes to start correcting it. And if you're consistent, the correction's going to be noticeable. You're not only going to see it, but you're going to feel it. So no invasive procedures, no back cracking treatments. You can do it right in your own home. And that is, again, check that pin comment below for the forward head posture fix. It is, in my opinion, the best program, the most simple program, the most cost-effective program to you to start doing things right now, to start correcting this forward head posture, correcting that ugly curve of the neck, to start helping yourself to feel better, and ultimately start supporting better respiration so that all around your overall health and wellness, your core stability, your spinal stability, your workouts, your sleep, everything is that much better. Thank you so much for watching this video. I hope you learned some new things, and I hope you're thinking about how important it is to start doing the little tiny things you can do to correct your forward head posture to have a huge domino effect on your overall health and ultimately really support the best and most optimal respiration for you. Don't forget to click that subscription button and the notification bell so you never miss any of our great content. And before you go, you want to check out that pinned comment below so you can find out how you can get the forward head posture program for yourself today, so you can start right now working on correcting your forward head posture, feeling better and breathing better. Take care, everybody. Have a great day. We'll be right back.